Hello everyone. Now I will tell you real quickly how can a diabetes affect in pregnancy. So diabetes can result in maternal complications as well as fetal complications. In maternal complications, in fetal complications, the diabetic baby is generally a big baby. So it is a macrosomic baby, and therefore once for the baby to come out of the vagina, it will be difficult because the baby is quite big. So what happens, the baby's shoulder might get stuck, so that is known as shoulder dystocia. So it can either be macrosomia or else it can result in a shoulder dystocia because of the macrosomic baby. And what would one do if we encounter shoulder dystocia? The Macroberts maneuver can be performed. How is Macroberts maneuver performed? The lady who has been in the lithotomy position, her thigh is put on her abdomen and the suprapubic pressure is given such that the fetus can be delivered without shoulder dystocia and without any obstruction. So in this way we are basically increasing the relative size of the outlet, vaginal outlet, and therefore the baby is being delivered. So macrosomic baby and shoulder dystocia are very common. What happens, sometimes it can also result in sudden death. Sudden death can also happen in the fetuses in these fetuses. Then seizures can happen. But why should seizures happen in the fetus once the child is born, once the baby is born? What will happen is till the time the fetus is in the womb, the glucose will pass through the placenta to the fetus, but insulin will not pass into the placenta. Since the glucose enters into the placenta, the baby will start producing insulin to combat that increased glucose. So this will be happening when the baby is in the womb. But once the baby is being delivered, the baby will still be producing increased insulin, right? Because it's been used to produce increased insulin. But that increased insulin will result in hypoglycemia because she is not getting that excess of glucose that she used to get when she was in her womb. So therefore, that increased insulin will cause hypoglycemia resulting in seizures. So this is the concept. But they can ask you anything, like they might give you like what is the reason? Decreased gluconeogenesis can be the reason, because if there is increased insulin is not going to cause gluconeogenesis. So decreased gluconeogenesis is one of the reason for seizures, isn't it? So in this way they can play with the words, and then they can tell like that, and then all these can be listed in their options. So you need to be careful about it. What are the maternal complications? Maternal complications, since it's a macrosomic baby and it is difficult for the baby to come out of the vaginal wall, it will result in a vaginal tear. So therefore episiotomy should be given. And polyhydramnios, we know very well that the diabetic people pee a lot. Similarly, the fetus which is present in the mother who is diabetic also pees a lot, resulting in a polyhydramnios. So these are the most common fetal as well as maternal complications that one should know. In addition to it, the fetus, the neonate, also presents with polycythemia. It leaves us wondering, why should they produce polycythemia? Because the diabetic is a systemic disease where it will affect the placental delivery to the fetus. So in that case, the fetus is not being provided with the adequate blood supply in the fetus. Therefore, the fetus suffers from hypoxia. To combat the hypoxia, the body of the fetus produces excess of erythropoietin, and therefore it can present with the polycythemia. So in polycythemia there is increased RBCs. When there is an increased RBCs, there is an increased breakdown of RBCs too. Therefore that also results in hyperbilirubinemia. In addition, the increased blood glucose will impair the PTH, parathyroid gland, and it will also imbalance the calcium status, and it can result in hypocalcemia, as well as it can result in hypomagnesemia. Why? Hypomagnesemia. Magnesium is supposed to be transferred from the mother to the fetus. So when this magnesium, the placental transfer of magnesium from the mother through the placenta to the fetus, if that doesn't happen properly, therefore it can cause hypocalcemia as well as hypomagnesemia. But when both these are given in the options, hypocalcemia, hypomagnesemia is also there. Which are you supposed to choose? They are more common. Only hypocalcemia occurs more commonly than hypomagnesemia. So, this is in short about the diabetes and its complications in fetus and in the mother.